The Adverse Childhood Questionnaire, or ACE questionnaire, is a screening tool based on a study completed with 17,000 people from 1995 to 1997. This study sought to determine the effects early childhood trauma have on future behavior and medical issues. The three categories include abuse, neglect, and family and household challenges. To administer the questionnaire, please keep in mind that this could be highly sensitive information and may be difficult for the patient to discuss. Offer to read each item individually to the patient, depending on their age, or allow them to complete the questionnaire by themselves. Each yes to the 10 questions should be totaled. A score of 1 or more indicates increased risk. 4 or more indicates severe risk. Therefore, primary care physicians should recommend further consultation with a mental health provider. Here is an example of how to administer the tool to patients. Now I have some questions to ask you that may be a little bit difficult to discuss. Your safety is the most important thing to me and your family. I ask that you be as truthful as possible. I will keep the information between me, your medical staff, you, and your guardian. Unless you share that you have been hurt or you are being hurt by someone or you're hurting somebody else. Is this something that I can read to you, or would you like to complete it on your own?
I would like to complete it on my own.
Okay. Here you go.
Thank you. Okay. That was really hard.
Thank you, though. You did a great job. I noticed that you checked yes for number 1, 4, and 6. Do you think you can tell me a little bit more about your parents' divorce?
Yes. So when my mom and my dad were together, they used to fight a lot. And I tried to break them up oftentimes because I wanted to do homework. And my dad would yell at me and tell me to mind my own business and whatnot. And when they ended up getting divorced, my mom was really, really sad a lot. And I had to do a lot of taking care of my brother, like brushing his teeth and cooking dinner. And now my mom is doing a lot better. But it was hard when they got divorced.
Yeah. That sounds like it was a really difficult time for you. I'm wondering if you have anyone to support you when you're feeling sad.
No, not really.
Well, if it's okay with you, I'd like to talk to your dad and see if we can help get you some extra support.
Thank you.
We already know Cynthia struggles with paying attention and focusing. This may be ADHD, but it can also be a symptom of stress or trauma. Further, an ACE score of 3 indicates high risk for mental health and further medical issues. This may be a good time for Cynthia to seek mental health services.